There's what we call a menstrual cycle, and there's what we call ovarian cycle. Ovarian cycle is the one that is responsible for the ovulation. Menstrual cycle is just the shedding that happens if pregnancy does not occur every month. The way the body is prepared, the body prepares in such a way that it expects pregnancy for every cycle. So when there's no pregnancy, the blood sheds and you see your menses. So when you think that you are fertile just because you are seeing your period every month, you have to think twice. There are two different situations, ovulation and menstruation, though they occur in parallel most of the time. So you may think you are fertile. I see quite a number of people, maybe in their early 40s, they think that, okay, my period is fine, so I should be fertile. No, it doesn't work that way. The quality of the eggs begin to diminish from 35. Egg quantity versus quality. Usually when we do assisted conception, when we see young people coming in for assisted conception, we expect that the eggs that we harvest should be higher in quantity. Whenever we find a situation where the harvested eggs are reduced, it may suggest that there is a problem. So, and for IVF, the more eggs that are harvested, the better your chances of getting good embryos that we're going to use for the procedure, So there's a huge difference in terms of quality and quantity. You are likely to have better quality when you have more eggs than fewer eggs. If it's few, then you have little to work with. So if it's fewer, it's also likely that the quality may be reduced. Quantity is reduced in people that are of advanced age, maybe like 35 and above. But for in vitro fertilization, assisted conception, we try as much as possible to probably increase the dosage of the medication as well as changing the kind of medication so that we can optimize and see and be able to get the best out of the procedure by harvesting more eggs in that regard. For women that are in their 40s, what we do is that first of all, we do a thorough assessment to assess the quality of those eggs. There are some tests that we do. It gives us an idea of what we have in there. It also guides the clinician to be able to know how to approach the management in terms of the type of medication to be administered and also in terms of the dosaging so that we can have something, we get something out at the end of the egg stimulation, that's at the end of the injections over many days. So once we get to that age, some tests, hormonal tests are done to help us know whether your eggs can be used, and if they can be used, how best we can optimize that process to making sure that we get the best out of the woman. The woman has a biological clock. We all know that at a certain age, the quality of the eggs, the potential for getting pregnant reduces considerably. As for the man, even if it reduces, it is not substantial enough to be seen to cause fertility problems. We all know that for men, when it comes to fertility, age does not have much to do with it. However, it may affect libido, sex drive, and the rest with age, but the fertility part, it is almost certain that with advancing age, we don't usually have any of those problems in terms of sperm parameters. So even younger people have sperm problems. So it's not a function of age at this time. Maybe other factors that may be responsible for that and not the natural causes like age. You can see your period till menopause occurs in late 40s or early 50s. But for ovulation, that's egg quality, egg release, as the woman gets older, from 35, we begin to see some changes in terms of egg quality, in terms of ovulation quality as well, in terms of propensity to get pregnant. So that is why some people, even when they get pregnant easily before 35, beyond 35 up to like 40, you will notice that the frequency of getting pregnant begins to reduce. And even beyond 40, whenever there's a natural pregnancy, the propensity for miscarriage also increases. In other parts of the world, when a woman that is more than 35 gets pregnant, she's screened for maybe congenital anomalies in the baby, because the chances of those things happening, especially things like Down syndrome, is quite high. So age matters a lot in a woman that wants to get pregnant. Menses may continue without any problems, but for your age, it is very obvious that egg quality will affect it. That's why we always advise, when you are more than 40 and you are coming for assisted conception, the option of donor eggs usually come into the discussion, because even when there's a pregnancy, there is a chance that there may be miscarriage, or the baby may have some congenital chromosomal abnormality. Yes, normal period for many people is that's the duration of the menstruation, 2 to 8 to 9 days is considered normal. What it simply means is this: if you see your period for only 2 days, you are fine. If you see it for 5 days, it is fine. If you see it for 7 days, it still seems to be fine. That's for duration. Then the cycle length. If you see your period every 21 days, as long as it is regular, it is very, very fine. If you see every 35 days, as long as it's regular, it is considered okay. A period is considered irregular if, for example, you see it for 21 days this month, and you see it for 28 days next month, you see it for 35 days the month after, you see it for 21 days again the one after that one. So you can see that it just fluctuates. It may suggest that there's a problem somewhere. But if you see your period 21 days this month, you see for 23 next month, see for 21 the month after, and 24 the month after, it is not supposed to be a problem, because it can never be perfect. I know that there are some people that theirs is clockwork. Every 28 days you must see their period. Yes, that is the ideal cycle length. But we have a lot of women that don't have any fertility problems. Their period will skip a day or two. If you use your calendar, skips. It's supposed to come on the 21st day, it doesn't come, it comes on the 22nd or 23rd, it's fine. It's fine. Then the month after, 1 day short is also fine. So it is important for you to know that before you start seeing your period and thinking it's irregular, it's actually not. Very few women do a 28-day cycle. But it doesn't mean that if you do a 30-day cycle or 31-day cycle, it is not okay. It's very okay. It's fine. So for now, this is all we have to say today. Till next week, when we continue to address your health and fertility concerns. Don't forget to turn on your post notifications, subscribe, and like, and also share our videos.